50 years, trillions of dollars, a mountain of arrests. Yet the US drug crisis is worse than ever. Every year, overdose deaths shatter new records. So the question isn't if the government knows how to fix it, but why they haven't. This isn't just about bad policy. It's about a hidden framework of politics, profit, and persistent racism that keeps the gears of addiction turning. To understand the failure, we have to look back at 1971, the launch of the war on drugs. The idea was simple: treat addiction as a criminal problem, not a public health crisis. The strategy focused on supply reduction and arrests. But what did that create? The mass incarceration machine. The more arrests, the more funding for police, prisons, and courts. It became a self-sustaining industry. There are powerful lobbies, private prison companies, law enforcement unions, who have a financial stake in maintaining the status quo of high arrest rates. They profit from prohibition. Decades of data show this war disproportionately targeted minority communities, creating a massive social inequality that drives further addiction because it destroys stable families and limits economic opportunity. Even though the failure is obvious, true change is paralyzed by political incentives. Any politician who advocates for decriminalization or fully funded treatment instead of jail time risks being branded as soft on crime. It's an easy, fear-mongering attack ad for their opponents. So they fund superficial measures that look tough but don't address the root cause. Shifting to a public health model with universal access to methadone, therapy, housing support, and mental health care is expensive upfront. Politicians prefer short, visible, and cheaper fixes, even if they fail long-term. They'd rather spend $80,000 a year to jail someone than $20,000 to save them. There is a growing movement to address the problem effectively, a quiet admission that the war on drugs has failed. This is the harm reduction movement. This approach acknowledges that drug use exists, and the goal is not immediate abstinence, but keeping people alive and reducing the negative consequences for both the user and the community. This includes providing naloxone, a drug that reverses opioid overdose, without a prescription, safe consumption sites, where users can take drugs under medical supervision, and clean needle exchange programs. So, the US government isn't not fighting. They're just fighting the wrong war, with the wrong weapons, for the wrong reasons. The real battle isn't against the drug user, it's against the political and economic system that profits from their suffering. What do you think is the biggest obstacle to real change in drug policy? Let us know in the comments below. Don't forget to like and subscribe for more deep dives into broken systems.